Hello everyone, welcome to Radiology Cases tutorial. Today we are going to discuss the sonographic features of renal infections. The infections of the renal collecting system and the renal parenchyma is called pyelonephritis. So first of all, we are going to discuss the pyelonephritis. Pyelonephritis usually is caused by the retrograde migration of the bacteria up the ureter and into the kidneys. Sonographic findings of the pyelonephritis include the urothelial thickening due to the involvement of the collecting system, and this urothelial thickening is a reliable sign of infection. Pyelonephritis also show the renal enlargement that is greater than the 12 centimeter, and it also causes the altered echogenicity of the renal parenchyma, and it produces the areas of both increased or the decreased echogenicity, which may be isolated or multifocal and produce the patchy appearance to the renal cortex, and it is associated with vasoconstriction that causes the decreased perfusion. Now we are going to discuss the pyelonephritis in the different patients. Now this is a transverse view of the right kidney, and this adjacent organ is the liver, and here we can see a thickening of the renal pelvis, and there is a single reflection from the mucosal surfaces that produces a thin white line that is surrounded by the hypoechoic thickened wall. And this is the transverse view of the kidney, and it shows the enlargement of the kidney and shows the scattered small areas of increased echogenicity in the renal cortex, giving the patchy appearance. Now this is the longitudinal view of the kidney that shows the large areas of increased echogenicity in the upper pole of the right kidney, and there are also the smaller areas of increased echogenicity throughout the right renal parenchyma. Now this is the longitudinal view of the right kidney that shows the power Doppler, and it shows a focal area of decreased perfusion in the upper pole of the right kidney, and these all features are suggestive of the pyelonephritis. Now we are going to discuss the renal abscess. Renal abscess is most often appear as a complex fluid collection or the complex cystic masses, and they can also be appear as a solid lesions, and they can be difficult to distinguish from the tumors based solely on the imaging appearances. Now this is the longitudinal view of the right kidney. This is the upper pole and this one is the lower pole of the right kidney. This longitudinal view of the right kidney shows a lesion with diffused low-level internal echoes, and it has a hyperechoic rim. Now this is a transverse view of the right kidney that shows the complex lesion with solid cystic structures, the solid components forming the thick internal septations, and the cystic components are due to the liquefaction. Now this is the oblique view of the right kidney that shows a solid appearing lesion with a few liquefied areas that is simulating renal cell carcinoma. But this longitudinal color Doppler shows a solid heterogeneous hyperechoic mass with no internal detectable blood flow. Now we are going to discuss an unusual type of renal infection, that is the xanthogranulomatous pyelonephritis. This is a chronic inflammatory process usually associated with long-standing urinary obstruction. The classic radiological triad is a stone, renal enlargement, and the lack of functions. Sonographic findings of xanthogranulomatous pyelonephritis include the shadowing stones in the renal pelvis together with the dilated renal calyxes, perinephric fluid collection, and perinephric inflammatory tissues. Now this is the normal sonogram of the right kidney that has normal echogenicity, and these hypoechoic areas are renal pyramids, and this adjacent organ is the liver. Now this is the longitudinal view of the left kidney that shows multiple echogenic foci that are showing the prominent acoustic shadowing. These are the features of renal calculi that are present in the renal pelvis. It is also showing the multiple distended renal calyxes, and these renal calyxes are also showing the internal diffused low-level echoes. These features are suggestive of xanthogranulomatous pyelonephritis. Now we are going to discuss another renal infection, that is emphysematous pyelonephritis. It is a serious renal infection that typically occurs in the diabetic woman, and it results from the formation of a gas in the renal parenchyma. stemming from the high tissue glucose concentrations, vascular diseases, and necrotizing infections with the gas-forming organisms such as E. coli. The sonographic diagnosis of the gas-forming infections depends on the detection of the bright reflectors with dirty shadows or the ring-down artifact, and it may be difficult to determine whether the gas is confined to the collecting system or involves the parenchyma. But CT is helpful for making this distinction. Now this is the normal renal parenchyma of the right kidney, and this adjacent organ is the liver. But here we can see the longitudinal view of the right kidney, and it shows markedly distended renal calyxes and multiple bright reflectors. These bright reflectors are due to the gas bubbles which is formed by the microorganisms such as E. coli, and these gas bubbles also showing the ring down artifact. These features are suggestive of emphysematous pyelonephritis.